Are you curious about Jantoven, the anticoagulant medication? In this comprehensive guide, we will dive deep into the workings of Jantoven, empowering you with essential knowledge about this medication. Anticoagulants play a critical role in preventing blood clot formation, reducing the risk of strokes, and managing various conditions. And Jantoven, with its proven effectiveness, has become a popular choice among patients. With this in mind, we've crafted an in-depth guide to help you understand Jantoven thoroughly. From its mechanism of action to the recommended dosage, side effects, and precautions, we've covered all the important aspects to keep you informed and confident. So whether you're a healthcare professional, a patient, or just someone interested in knowing more about Jantoven, this guide will serve as your trusted resource. We've simplified complex medical jargon and presented information in a clear and concise manner, enabling easy comprehension even for those new to the topic. Discover the secrets behind Jantoven's effectiveness and learn how this anticoagulant can improve your quality of life. Let's embark on this informative journey together. What is Jantoven? Jantoven is a brand name for the generic drug Warfarin sodium, which belongs to a class of medications known as anticoagulants. Anticoagulants, also referred to as blood thinners, are substances that help prevent the formation of blood clots in the blood vessels. Jantoven works by inhibiting the production of certain clotting factors in the liver, thereby reducing the ability of the blood to form clots. Jantoven is commonly prescribed to patients at risk of developing blood clots or those with certain medical conditions such as atrial fibrillation, deep vein thrombosis, DVT, or pulmonary embolism. It is also used as a prophylactic measure for patients undergoing surgical procedures that carry a high risk of blood clot formation. It is important to note that Jantoven should only be taken under the supervision of a healthcare professional, as it requires careful monitoring and dosing adjustments to ensure its effectiveness and minimize the risk of complications. How does Jantoven work? Jantoven exerts its anticoagulant effect by interfering with the production of vitamin K-dependent clotting factors in the liver. Vitamin K is an essential nutrient involved in the synthesis of clotting factors 2, 7, X, and X. These clotting factors are crucial for the normal clotting process in the body. Jantoven works by inhibiting an enzyme called vitamin K epoxide reductase, which is responsible for the recycling of vitamin K back to its active form. By blocking this enzyme, Jantoven depletes the active form of vitamin K, resulting in reduced synthesis of clotting factors. This ultimately leads to a prolonged time for blood to clot, reducing the risk of abnormal clot formation. It is important to understand that Jantoven does not dissolve existing blood clots, but rather prevents the formation of new ones. If you already have a blood clot, your healthcare provider may prescribe additional medications or procedures to treat it. Uses of Jantoven. Jantoven is primarily used to prevent and treat blood clots in various medical conditions. It is commonly prescribed for patients with atrial fibrillation, a heart rhythm disorder that increases the risk of blood clot formation in the heart. By taking Jantoven, these patients can significantly reduce the risk of stroke, which can occur if a blood clot travels from the heart to the brain. Jantoven is also indicated for the prevention and treatment of deep vein thrombosis, DVT, and pulmonary embolism. DVT refers to the formation of blood clots in the deep veins of the legs, while pulmonary embolism occurs when a blood clot travels to the lungs. Both conditions can be life-threatening, and Jantoven plays a crucial role in reducing the risk of recurrence and managing these conditions. Additionally, Jantoven may be prescribed for patients undergoing certain surgical procedures, such as hip or knee replacement surgery, to prevent blood clot formation during the recovery period. It is important to follow the prescribed dosage and duration of Jantoven therapy to ensure its effectiveness and minimize the risk of complications. Dosage and administration of Jantoven. The dosage of Jantoven varies depending on the individual's condition, medical history, and response to the medication. It is important to follow the prescribed dosage and any adjustments recommended by your healthcare provider. Jantoven is available in tablet form, which should be taken orally with or without food. When initiating Jantoven therapy, your healthcare provider will carefully determine the appropriate starting dose based on your individual factors. This initial dose is often lower than the maintenance dose to allow for proper adjustment and monitoring. Regular blood tests, such as the International Normalized Ratio, INR, will be conducted to assess the effectiveness of the medication and ensure the optimal dosage is maintained. The dosage of Jantoven is highly individualized and requires close monitoring to achieve the desired anticoagulant effect without increasing the risk of bleeding. It is important to communicate any changes in your health status, medication use, or lifestyle factors to your healthcare provider to ensure the appropriate adjustments are made to your Jantoven regimen. Potential side effects of Jantoven. Like any medication, Jantoven carries the risk of side effects. While not everyone experiences side effects, it is important to be aware of the potential risks and seek medical attention if any symptoms arise. Common side effects of Jantoven may include bleeding. Since Jantoven reduces the ability of blood to clot, it can increase the risk of bleeding. This can manifest as easy bruising, nosebleeds, bleeding gums, or prolonged bleeding from cuts or injuries. It is important to promptly inform your healthcare provider if you experience any signs of bleeding. Skin changes. Some individuals may develop skin discoloration or other skin changes while taking Jantoven. This can appear as purple toes, livido reticularis, a mottled appearance of the skin, or skin necrosis, death of skin tissue. These changes may indicate a compromised blood supply and should be immediately reported to your healthcare provider. Hair loss. In rare cases, Jantoven may cause hair loss. If you notice significant hair loss or changes in hair texture, consult your healthcare provider for further evaluation. Allergic reactions. Although rare, some individuals may experience allergic reactions to Jantoven. Signs of an allergic reaction may include rash, itching, swelling, dizziness, or difficulty breathing. If you suspect an allergic reaction, seek immediate medical attention. It is important to note that this is not an exhaustive list of side effects, and individual experiences may vary. Always consult your healthcare provider if you have any concerns or questions regarding the potential side effects of Jantoven. Precautions and interactions with Jantoven. Jantoven requires caution and certain precautions to ensure its safe and effective use. It is important to inform your healthcare provider about any medical conditions, medications, or supplements you are taking to minimize the risk of interactions or complications. Some important precautions and interactions to consider include bleeding risk. Jantoven increases the risk of bleeding, so it is important to avoid activities or situations that may increase this risk, such as contact sports or excessive alcohol consumption. It is also crucial to inform your healthcare provider of any other medications or supplements that may further increase the risk of bleeding, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or certain herbal remedies. Pregnancy and breastfeeding. Jantoven is generally not recommended during pregnancy, as it can potentially harm the developing fetus. If you are pregnant or planning to become pregnant, discuss alternative anticoagulation options with your healthcare provider. Similarly, Jantoven passes into breast milk and may harm the nursing baby. Consult your healthcare provider regarding the appropriate course of action if you are breastfeeding. Interactions with other medications. Jantoven can interact with numerous medications, including prescription drugs, over-the-counter medications, and even certain herbal supplements. These interactions can affect the effectiveness of Jantoven or increase the risk of bleeding. Always inform your healthcare provider about all medications and supplements you are taking to minimize the risk of interactions. Dietary considerations. Vitamin K plays a crucial role in the effectiveness of Jantoven. It is important to maintain a consistent intake of vitamin K-rich foods while taking Jantoven to ensure the medication's stability and effectiveness. However, drastic changes in dietary vitamin K intake can affect the dosage requirements of Jantoven. Discuss any significant dietary changes with your healthcare provider to ensure appropriate adjustments are made to your medication regimen. Monitoring and managing Jantoven therapy. Jantoven therapy requires regular monitoring to ensure its effectiveness and minimize the risk of complications. The International Normalized Ratio, INR, is a common blood test used to evaluate the clotting ability of the blood and determine the appropriate dosage of Jantoven. The target INR range will depend on the individual's condition and the purpose of anticoagulation therapy. During Jantoven therapy, your healthcare provider will schedule regular INR tests to assess the effectiveness of the medication. Based on the INR results, adjustments to the dosage may be made to maintain the desired therapeutic range. It is important to attend these appointments and promptly report any changes in your health status or medication use to your healthcare provider. In addition to regular INR tests, your healthcare provider may also recommend periodic blood tests to assess other parameters, such as liver function, kidney function, or complete blood count. These tests help monitor your overall health and ensure the safe use of Jantoven. Important considerations for patients taking Jantoven. Patients taking Jantoven should be aware of certain considerations to ensure the safe and effective use of the medication. These considerations include regular follow-up appointments. Jantoven therapy requires regular follow-up appointments with your healthcare provider. These appointments allow for the monitoring of your condition, adjustment of the medication dosage if necessary, and addressing any concerns or questions you may have. Medication adherence. It is crucial to take Jantoven exactly as prescribed by your healthcare provider. Missing doses or taking incorrect doses can affect the medication's effectiveness and increase the risk of complications. If you have difficulty adhering to the prescribed regimen, discuss it with your healthcare provider to find a solution that works for you. Emergency preparedness. Since Jantoven increases the risk of bleeding, it is important to be prepared for emergencies. Carry a medical alert card or wear a medical alert bracelet to inform healthcare providers about your anticoagulation therapy. In case of an emergency or injury, notify healthcare providers about your medication use to ensure appropriate treatment is provided. Communication with healthcare providers. Open communication with your healthcare provider is vital when taking Jantoven. Inform them about any changes in your health status, medication use, or lifestyle factors that may affect your Jantoven therapy. This allows for timely adjustments and ensures the optimal management of your condition. Alternatives to Jantoven for anticoagulation therapy. While Jantoven is a widely used anticoagulant medication, it is not the only option available. Several alternatives to Jantoven exist, each with its own advantages and considerations. Some common alternatives to Jantoven include direct oral anticoagulants, DOACs. DOACs, such as apixaban, rivaroxaban, dabigatran, and edoxaban, are newer anticoagulant medications that have gained popularity in recent years. Unlike Jantoven, DOACs do not require regular INR monitoring, making them more convenient for patients. They also have fewer drug interactions and dietary restrictions compared to Jantoven. Heparin. Heparin is another anticoagulant medication commonly used in various clinical settings. It can be given intravenously or subcutaneously and is often used for short-term anticoagulation needs, such as during hospitalization or before surgery. Heparin requires close monitoring of blood parameters and may need to be bridged with Jantoven for long-term anticoagulation. Low molecular weight heparin, LMWH. LMWH, such as enoxaparin or dalteparin, is a type of heparin that can be given subcutaneously. It is commonly used for the prevention and treatment of DVT and pulmonary embolism, as well as other conditions requiring anticoagulation. LMWH has a more predictable anticoagulant effect compared to standard heparin and does not require frequent monitoring of blood parameters. Aspirin. Aspirin, an antiplatelet medication, is sometimes used as an alternative to anticoagulants in certain low-risk situations. It works by inhibiting platelet aggregation and can be effective in reducing the risk of blood clot formation. However, aspirin is not as potent as anticoagulants and may not be suitable for all individuals. The choice of anticoagulant therapy depends on various factors, including the individual's medical condition, risk factors, and personal preferences. Your healthcare provider will carefully evaluate these factors and recommend the most appropriate anticoagulant for your specific needs. Conclusion. Jantoven, with its proven effectiveness as an anticoagulant medication, plays a crucial role in preventing blood clot formation, reducing the risk of strokes, and managing various medical conditions. By inhibiting the production of vitamin K-dependent clotting factors, Jantoven helps maintain the balance between clotting and bleeding. In this comprehensive guide, we've explored the mechanisms of Jantoven, its uses, dosage, potential side effects, precautions, and alternatives. Understanding these aspects empowers individuals to make informed decisions about their anticoagulation therapy and promotes safe and effective use of Jantoven. Remember, Jantoven should only be taken under the supervision of a healthcare professional, and regular monitoring is essential to ensure its optimal effectiveness and minimize the risk of complications. If you have any concerns or questions regarding Jantoven or anticoagulation therapy, consult your healthcare provider for personalized guidance. Thanks for watching.